Hi, my name is Michelle Ayers, and I am in Research Method Class 312, and I'm about to read my research paper. Name of my topic is Does Alcohol Addiction Affect Teenagers' Behavior? Cleveland State University. It is very important for society to know about teenage alcohol addiction. Teens who drink are more than likely to become a victim of crime, violent crime, and are also known to be involved in traffic accidents and school accidents and incidents. Most underage drinkers began drinking at the age of 10 to 14 years old. Teens are also easily influenced by peer pressure. It has been stated that teens who use alcohol are more than likely to become sexually active. Teens are known to become binge drinkers, and study shows that alcohol use is unsafe. There are a lot of problems that are associated with alcohol, and it is very important that parents talk to their child. Parents who support and build a strong relationship with their child will help them to avoid alcohol use. There are different strategies parents can use, such as keeping tabs on their teen activities and developing family rules. Parents should also let their teens know there are consequences of underage drinking. There are ways to avoid alcohol use by enforcing and setting rules about alcohol drinking. Parents should also learn to develop a closer relationship with their teens will help to eliminate problems in the near future. It is very important for society to know about teenage alcohol addiction. Teens who drink are more than likely to become a victim of violent crimes. Teens are also known to be involved in traffic accidents. Most underage drinkers began drinking at the age of 10. Okay. Alcohol dependence and addiction has the tendency to disrupt normal balance and self-control mechanism involving teen emotional drive. The main goal was to identify early teens to intervene before addiction developed. Levels includes binge drinking and a long-term effect that it will have on underage drinking. And this will help to understand why teenage drinkers who consume is dangerous. According to American School Health Association, school kids have the tendency of trusting their teachers and believe they care about their well-being. With the support, they are less likely to engage in alcohol and drugs. Alcohol addiction protocol includes institutional review board and parental permission. Adolescents or adolescents, alcohol abuse programs have to develop effective prevention and intervention. The population group include who ranges from middle school to high school age. The subjects are recruited from schools, advertisement, community center, which target teenagers to represent data collection. The research method use interviews, surveys to collect data and drinking, social influence and behavior, brain development, utilizing instruments which are standardized alcohol questionnaires and measure a cognitive function to assess teen involved. Data collection methods includes focus group, self-administered surveys, biological samples, and interviews. Statistical measures includes multiple logistic regressions models. It was concluded that alcohol abuse dependence was significantly associated with age, income, schooling, religion, and illicit drug use. Early onset of drinking being linked to increased risk of alcohol problems which occur later in life will also have a negative impact on cognitive functions. The purpose of the study is to determine the background of teenagers who consume alcohol. The purpose was show how excessive alcohol can associate itself to many risk factors when consumed in teenage drinking, with having multiple risks for chronic disease, which can lead to increase of injuries. Liver disease can cause disabilities during pregnancy. Alcohol caused more than 140,000 deaths. The population group was based on the age categories and ranged from 2 to 24 years old. Data collection includes liquor consumptions, behavior teenagers, central Java, and the percentage of alcohol that was consumed. According to the World Health Organization, use of alcohol is one of the 9 communicable diseases in 2025. Television is known to be a well-documented socialization that increase and influence youth. Public Health expresses its concern that television sends messages to youth in drinking. It has been said in 1991, which aims to reduce the harm that was caused by alcohol. The government did pass measures that were directed towards alcohol advertising. The study was based on pediatric audience that measured youth ages from 15 to 19, and 14 was the most who watched TV series. Method relies on a content analysis to identify the pattern and frequency of TV series watched by French teens. The purpose of the study is to determine Lebanese and general populations and how it increases due to water pipes, smoking, cigarettes, alcohol drinking, and the use of internet. The purpose of his research was to determine the relationship between each attachment style. Okay. Drinking can be as severe to public health issues, whether a person tastes or sips alcohol. It can lead to alcoholism. This study looks at teens in Asia countries. There was literature search and database publication to issue 64 records, and the one that did not fit were removed. The population was gender, age, religious belief, and family members. Literature's qualified was summarized, and the data on the subject was gathered, and participant was exposed. An outcome was the data collected. The technique they were used was Prisma data modeling, extractions. All the data mentioned was current. Alcohol is a factor that has been said to influence teenagers. The purpose is to help teens overcome alcohol addiction by collaborative counseling that helps to bring individual families and group with discipline. Mixed method to triangular design type, namely collecting quantitative and qualitative data. This research was carried out for 6 months or 24 weeks. The results of alcohol amount, youth activities, and religious activities. The success of counseling is known to be activities that can help answer individual needs, which can motivate and effectiveness of everyday lives. There were report levels of alcohol intake that was required from teenagers. Alcohol abuse is known to be serious problems in the world, according to the World Health Organization. The volunteer group were teenagers. There were 448 teens who participated, who were the ages of 14 to 19. A total of 96.6% identified themselves ethnically as half-blood, 2.7% as white, 0.4% as Indonesians. The sample, 57.4%, live in urban areas, while the remaining 42.6% live in rural areas. The descriptive analysis was conducted, and the means is an average age of participant. Standard error is measure of population. The median is a middle value in the set of numbers that appears. The modes refer to a number in the set of numbers that appears the most. Standard deviation is a measure of how dispersed the data is in relation to the mean. Sample variance is the square root of sample variance is a measure of a spread from the expected value. Kurtosis is how much of the probability distribution falls in the tails instead of its center. Range is difference between the highest lowest value. Minimum is the smallest number in the set of data. Maximum is the largest value in a set of data. Sums refer to the value obtained by adding up all the data points and giving data set. Count is the statistic data to describe uncountable quantities, data which can take only counting numbers.